So today we're going to talk about lung volumes or capacities and their importance in a pulmonary function test. So just to give an overview, on average, adult male lungs can hold about 5.7 liters of air, and females can hold about 4.7 liters of air. Although this is the maximum, the lungs don't ever really fully inflate to this capacity. Instead, what is known as quiet breathing, the lungs are only going to partially inflate and partially deflate. So they never inflate to maximum capacity or deflate to maximum expiration during this quiet breathing. You would have to be purposefully taking in these extra breaths or letting out extra breaths. At the end of a normal quiet expiration, the lungs will still contain about 2,200 milliliters of air. During each typical breath under resting conditions, about 500 milliliters of air is what is inspired and then also expired. So during quiet breathing, the lung volume varies from about 2,200 milliliters at the end of expiration to about 2,700 milliliters at the end of inspiration. And just another important note, even during a forced exhale, so, you're trying to blow out as much air as possible from your lungs, you're never actually able to completely empty them. This would actually cause a collapse of your lungs. Even if you force out every little bit that you can, there's still going to be about 1,000 to 1,200 milliliters remaining at all times. The nice thing about this is it does still allow for gas exchange to continue because there's always air in those lungs. All right, so now we're going to talk about lung volumes. So this is just kind of the different classifications of volumes that you can look at, record, and then analyze. So first would be the tidal volume. This is the air that's entering and leaving the lungs during quiet breathing. So again, we said that amount is about 500 milliliters. Next would be the inspiratory reserve volume, or IRV. This is going to be the air that's inspired over and above the typical resting tidal volume. So this is about 3,000 milliliters. And if you look here, so that IRV, you can see that that's that pink region. So the tiny little tidal volume waves you can see, and then anything that you can inspire past that normal tidal volume, that's going to be your inspiratory reserve volume. Next is the inspiratory capacity. So this is the maximum volume of air that can be inspired at the end of a normal quiet expiration. So that would be your tidal volume plus your IRV. And this is going to be about 3,500 milliliters. So that 3,000 milliliter of the inspiratory reserve plus that 500 milliliters during the tidal volume equals that 3,500. You can see that on here. That is the pink region, and the darker purple region is the IC. Next would be the expiratory reserve volume. So this is going to be the air that can be actively expired beyond that normally passively expired at the end of a typical resting tidal volume. And this amount is about 1,000 milliliters. So again, on here, this is going to be that light purple region. So after normal quiet breathing, breathe out, anything additional that you can breathe out past that is going to be that expiratory reserve volume. And again, notice that there's still air left in there because we said you can't ever fully expire all of the air from your lungs or it would cause your lungs to collapse. Some other classifications of lung volumes we have here. So we have residual volume, and this is going to be that air remaining in the lungs after a maximal expiration. So you've breathed out all the air you can, how much is still left in, and that's about 1,200 milliliters. That's going to be that lime green section of this graph that represents the residual volume. The functional residual capacity, or FRC, is going to be the air in the lungs at the end of a normal passive expiration, and that's about 2,200 milliliters. So that FRC is going to be that light purple plus the light green. All right, and then you have the vital capacity. So this is the air that can be moved out, expiring maximally after inspiring maximally. The VC is going to represent the maximum volume change possible within the lungs when you are forcibly breathing in and forcibly breathing out. And that is represented by the pink, the dark purple, and the light purple on the graph here. And then we have the total lung capacity. So the total lung capacity is going to be the maximum volume of air that the lungs can hold. And that's represented by the vital capacity plus the residual volume. And again, on here on this graph, that's going to be all four colors combined, which equals about 5,700 milliliters to equal that total lung capacity. Now, each of these volumes can be investigated through pulmonary functional tests. And then depending on what the results are from that, they're actually able to diagnose certain disorders in patients. So measuring lung volumes. The first way that this can be done is with a spirometer. This was first done with what is called a wet spirometer. So this was a air-filled drum that would be floating in a water-filled chamber. As the person will breathe out into this closed system, the drum, it breathe in and out of the drum through a tube connecting. The drum will rise and fall in the water chamber. This rise and fall is going to be calibrated and consistent with the changes in the lung volume. And then it's recorded as a spirogram, which is that graph that we were just looking on the last pages as well. Inspiration is recorded as an upward deflection, and expiration is recorded as a downward reflection. Today, computerized spirometers are going to have replaced the wet spirometer for clinical use, but the principles of this are still going to be the same as that wet spirometer, which is what first started. And you can see an example of what that looks like on the right here. All right, so another way that this is done is through something called body plethysmography. So there's different types of this. The first one is called pressure. So a pressure plethysmography measures your lung volume. It does this by measuring the gas pressure changes in a clear airtight plastic box. So the box contains a fixed amount of air, and then a special machine connected to the mouthpiece called a spirometer measures the volume in the thorax. So that pressure change as the patient is breathing is what actually measures the volume. A volume plethysmograph is when it's going to measure gas volume changes by measuring gas displacement in a clear airtight plastic box. So when the gas volume changes in your thorax, the surrounding air in the box will emit through a hole in the wall that's then connected to a spirometer. And then this spirometer is measuring the airflow. And then you have a pressure volume combination. And this test will combine the elements of a pressure and a volume plethysmograph. As you breathe, any volume changes in your thorax are going to force the surrounding air in the box through a hole in the wall into the spirometer. And then this is just an example of what that looks like. So the patient will be sitting in this box. You'll have the technologist or technician conducting the pulmonary function test. And then that spirometer reading is on the right there. So you can see the small waves are seen first there, which again, if you remember, that corresponds to our tidal volume, which is that normal quiet breathing. And that you can see the IRV, the IC, the ERV, the RV are all represented on that graph as well. So during this, they're going to give instructions to the patient. They'll have them just sit and quietly breathe. Then they'll say, breathe in your maximum amount of air, breathe out your maximum amount of air. And by taking these different measurements, they're able to look at the function of the lungs. So different types of diseases that they can classify from this. The first one would be an obstructive lung disease. So this is going to be the patient has difficulty in emptying the lungs. It's usually caused by damage to the lungs or narrowing of the airways inside the lungs. Examples of this could be COPD, chronic bronchitis, asthma, bronchiectasis, bronchiolitis, or cystic fibrosis. So with this, again, you can see that they can inhale and take that normal amount in, but when they're trying to empty the lungs or breathe out, they're not able to empty at the same volume that someone without this disease would have. And then the opposite of that would be a restrictive lung disease. So this is when the patient has difficulty in filling the lungs. This is usually caused by a stiffness in the lung themselves, or in other cases, stiffness of the chest wall, weak muscles, damaged nerves may also cause the restriction in lung expansion. Some examples of this include interstitial lung disease, sarcoidosis, obesity, scoliosis, or a neuromuscular disease such as muscular dystrophy and ALS. So you can see on here, the patient has difficulty taking that deep breath in to get to that 5,700 mLs, which would be a normal total lung capacity, but they are still able to breathe out and expire the amount that we would see. So it's just that difficulty in filling the lungs. So knowing what these values are and what they represent on the spirogram is very important, and being able to read the lung function tests and be able to diagnose the patients and get them the correct treatment for whatever disease they are currently dealing with. And these are the references that were used. Thank you.